Good morning, everyone. Greetings from the Institute of Global Professional IGP Bangladesh. Greetings from the Institute of Global Professionals IGP Bangladesh. Thank you all for joining us and staying with us till the end. Honorable Knowledge Seeker, today I am your host for the morning. My name is Yarnis Akhtar. I am from Bangladesh. Dear Knowledge Seeker, I am proud to be associated with the IGP as a global member. IGP, a non-profit organization, is a social and ISO certified international training institute. In 3 years, we already serve 3 million knowledge seekers from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 250 plus profession and 4,500 plus organizations. Institute of Global Professional (IGP) is an ISO 9001, 2015 and 10002. 2018 is the training faculty for skill development, which was founded in 2020 and is channeling competent candidates to meet demand in the global labor market by providing professional qualifications. The Institute of Global Professional is an educational institute that provides social work globally recognized and reputable. We serve student and community resource providing holistic social work and education. We believe that it is not effective to increase one's skill just by acquiring formal education. So we provide effective training and consultation to generate professional generation all over the world. We distribute our services locally, nationally, and internationally to students, job seeker, job holder, and also for learner through respective campus location and distance learning platforms. We are an occupational and dependable institution. IGP is one of the famous online institutes from all over the world. Our vision is education is not a business product, it's a part of our human rights. Based on our vision, we're trying to reach all corners of the world for free webinars, seminars, courses, awards, quiz competition, mentoring, and counseling aids. On the other side, we're also trying to serve more than 100 premium services for free, like with own portfolio website, resume builder, cover letter, motivation letter, and one knowledge platform for gathering general knowledge which can update all day. Kids learning games, website, free courses, converter search, and many, many more. We have to empower youth to learn to meet their expectation and dreams and become highly skilled people. We implement several trainings, programs, webinars, and offline online courses for youth and learners by professional trainers, speakers, and coaches. Our sessions are conducted by globally renowned professionals to develop all kinds of youth and to promote the education of their abilities and personalities to ensure excellent and in deep instruction we arranged with qualified trainers, speakers, and instructors. We extend free services to more than 3 million knowledge seekers in last 3 years. We have integration with universities and organizations in 70 different countries. Virtual MOOC signing with many colleges and organizations have been accomplished. We are working to create a legendary generation of future scholars and citizens who will be accountable. We are constantly prepared to assist all knowledge seekers with valuable service. Spreading knowledge is crucial for the Institute of Global Professionals. We believe that knowledge is love, light, and vision. So we try to understand the needs of today's generation and serve them with good research and practiced methods. We must have a genuine concern for the learners. We represent more diversity, growth, and innovation are required. To lead a session with professionalism, passion, and integrity, IGP members are committed to offering effective, best quality service and continual improvements so that individuals who seek information can improve their skill levels and value. Before we move to the next, let me remind you don't forget to share, tag, and mention your friends in the comment box. Before we move to the next, let me remind you don't forget to share, tag, and mention your friends in the comment box. Your support is very valuable to us. Thank you. Moving to the next, with your continuous support, we already completed 1,344 webinars successfully. Oh, moving to the next, with your continuous support, we already completed 1,344 webinars successfully. Now at present, we are going to start our 1345 and our program name is Health Insurance Everyone's Need. And today our speaker name is Dr. Sunil Kulkarni. Dr. Sunil Malhar Kulkarni. He's from India. Today our speaker has some face technical issue for that he cannot join with us. So now we'll run our quiz session. After a short video, we'll start our quiz session. To join our quiz session, please follow my instruction carefully. First, you have to go www.slido.com. Then you have to enter the code, and the code is global IGP. And the code is global IGP. dear IGP knowledge seeker, our speaker now join with us. So now we'll start our presentation session. After that, we will again start our quiz session. So please now welcome our speaker. Today our speaker name is Dr. Sunil Malhar Kulkarni. He is from India. He is assistant professor VU College of Nursing, Shanghai. So now let's welcome our speaker. Hello, sir.
Uh, can I upload the PPT? I think it's working.
Yes, you can upload.
Madam, myself, Rak Maraki.
Is it uploading, sir?
Yes, ma'am. It's about over. We'll check?
Yes. Sir, move to the next slide. Okay, everything is okay. So,
Yes,
sir,
ma'am.
now you can start your presentation. First, you have to give
Yes.
some description about yourself.
Okay, ma'am. Ma'am, can you hear me and see me?
Yes, I can
Hello,
hear
ma'am.
you and see you properly. You can start.
Okay, ma'am. First, I would like to say sorry due to some net issues are there, and I kept awaiting, especially for the members who are attending. But with your patience and cooperation, I am starting this presentation. Very short introduction about me. I'm Dr. Sunil Kulkarni from Bharati Vidyapeeth College of Nursing, Sangli. I completed my PhD. I am PG, UG, and PhD faculty teachers, as well as I conducted various researches, published, and editor, author for various journals, and from last 2 years, I am connecting with you. With this short introduction, I will start my presentation. This is a short outline of my presentation. What is the health insurance? What is the present situation in India? What are the ways how to get it, use it, and what are the advantages? What are the challenges are there, and what important points keep in to mind? Insurance is universal. So general insurance we are taking, maybe personal, maybe car, maybe building, other things are there, but rarely we are taking health insurance. It's in India as well as I think it is in all developing countries as well as even the developed countries. These are the few figures are there. We'll get the idea that on an average in India, it is about 6.5% annual income we are losing for the health care. And if any major problem occurs, the percentage of income goes to the 37.4, means more than about half percent we are spending for the healthcare. A study also says many members that they are spending around the 65% income for the health, and they becomes lifelong debit for the life. As compared to the developed country like US, UK, their population insured, health insured is around 30% to the 50%. What is meaning of health insurance? Health insurance is type of insurance like other insurances, but especially related to cover the health services. Health services include medical services, drugs, consultations are there, hospitalizations there, or treatments are there. So we'll get it all the health services. Which services we are getting? Indoor services when you are admitted in any health setting, maybe hospital or maybe clinic, or OPD services, medical surgical care, maybe diagnosis, treatment, curative, rehabilitative, perform the various investigation tests are there, various tests, providing certain medications when you are attending the OPDs or hospitalization. Mother and child special services we are providing health checkup in case of routine or in special case, for providing in a rehabilitation those having some loss of certain body parts, and even for the certain cases chronic health problems like cancer, tuberculosis, hypertension, for their transportation also we will get the benefit. So why to take, why the hospital cost is increasing? And that's why so many members they are not using the health services or not taking the health insurance. One, the cost of articles, drugs, and taxes they are very high. Second, using of the advanced technology. So the technology knowledge and related taxes, it increases the cost. Third, high remuneration of the health team members. Doctors and other members are there. Then use of the super specialty services. Nowadays there are each and every part there you can find various health team members are there, specialists in their services. And next is very important and common, that business minded health services. So hospital previously it was health services, but nowadays it become as a industry, commercialization is there. And lastly the inflation is there, inflation increase of cost of each and every product and services or goods or services. Why we need health insurance? What is its importance? So once you are taking the health insurance, you will free from stress or tension of the medical care, because the cost is a major problem that is secured by the healthcare agency. Second, coverage against the critical illness. Health insurance covers major critical illness, those having high expenditures with few premiums. When you are taking the policy, you will get maximum treatment. Third, cashless claim benefits. So need not to carry the money for various tests, drugs, investigation, treatment, surgery, or another. Cashless it will occurs. Additional protection you will get when you are employer, because as employee you are doing, as well as employee from their security point of view they are also providing the health insurance. It also helpful for tax benefits are there. When you are as a worker, they will provide you a tax concession in your income. Reimbursement means when you are paying for any test, investigation, treatment, when you are claiming, you will get the money back. Make the quality treatment affordable. Policy with minimum cost, we are getting super specialty or quality care. Increase the use of health services because of availability, easy availability. Most of the members they will take the health services. It protects household from the high medical expenses. There are some examples. Some patients they are selling their land, their pets, even their home or various properties are there to recover the health. when you are taking health insurance, this major problem will not occur. These are the few reasons are there why you have to take. These are the same what I told now. When you are using the health insurance, so this is a different aspect is there. So we must know certain terms. So what terms they are using when you are interacting with the health insurance? One is the policy. What is a policy? Policy means legal document is issued by insurance company that outlines the terms and condition of insurance. So what they are providing the health services, where they are providing, what is the cost, how to keep follow. Second, policy holder. Holder means who is bought it. So person who buys the insurance, it also called as insured. Third is a premium. Premium is the payment when you are buying the policy, and every year it has to keep in active or in force. You are paying some amount that is called as premium. Then claim. Claim means the person requests for the payment when it's injured or he has paid for the treatment as a reimbursement. Then there are first party, second party. These words are there. What is first party? It means claim by the own insurer, insurance company. You are the person directly claim it. Whereas third party means through certain agencies, maybe hospital. Then exclusions. Exclusion means there are certain health conditions are there, diseases are there, situations are there. For that health insurance is not available. Occurrence means incidents where we get the body injuries and we are taking health services through the health insurance policies. Peril. Peril means cause of loss or damage. So they are given certain causes. For that only the reimbursement or claims are available. If it is intentional injuries there, in that cases you will not get the claim. Even the health problem is there. Next is the risks are there. So whatever the policies are there, you have to keep update, do not lose it. If you are not providing its number or originals, there is difficult to provide the services. Last is the underwriting. When you are taking the policies, you have to understand each and every terms and benefits are there, terms and conditions are there. These certain terms are very important when you are taking the policies and its benefits are there. So these policies or insurance, they are provided by two members importantly. One is the government for maximum members of population. It is overall the world. It happens in India, Bangladesh, developing country or even African country. So government is providing and private agencies they are providing. So why government agencies are more beneficial? Because these are affordable policy at a cost, low cost, or even there are free of cost. Some health policies are there, they are free of cost. Second, it is easily available for each and every member, especially those are underprivileged, those are below the poverty line members. So government is reaching, the members are reaching and helping them to get it. Third, ensures the poor peoples, those sort of the insured covers. So the poor people also get better health services to maintain health and wellness. Government policies, they are feel assured because we are secure on the government. They will not cheat us or that policy will not relapse. The company will not fraud. Lastly, inclusion of the governments and privates. These are somewhat features are there. So when you are taking health insurance policy, you need very few requirements are completed. First, very important, that is a personal information, age. So different health policies, they are for different age group, income group, areas are there. So that information you have to provide. Second, you must go through or take the help of advisor of health insurance member. So you'll get the details. Try to clarify your all the doubts, queries, questions according to your need. You have to take the plan. Third is Aadhaar card. it is a universal identification document is there. And lastly, you have to pay. It may be free, it may be partial amount, it may be total amount based on your private and government health insurance policies. So 4 documents: personal information, know the proper, Aadhaar card, and small amount of payment. So before getting it, just review these points. So things you have to check before buy the health insurance. First, what is the waiting period? Means when you are having the policies and getting the health services. It should be very short or no. Immediately you can contact to the particular agency and get the services. Cover the pre-existing diseases. So later on it is there some pre-existing diseases not covered, but you have to take it before presence or in presence of certain diseases. Claim process is very simple, fast, and get proper complete. Renewability, if you need to upgrade the policy, so there is chance to upgrade is there, as well as exclusions. They have to clearly say that what is the exclusion, so there will be no disturbances later on. And provision of cashless services. So now carry the money. The agency will provide the money. So how to choose? Just these are the few points are there. Protection to the large member, flexibility of the health coverage, no changes in the premium as I said proper. Long-term policy is important because we are living more than 60, 70, 80 years. So take the maximum age coverage. Then the coverage of the hospital area where you are getting services that should be available to you, near to you, or accessible to you, and fast provide of medical help as well as financial help. So in health insurance concept, there are certain structures are there, persons are there, they are performing. So 3 important members are there. One is the insurer. Insurer means who is buying the health insurance policy. Second is the provider. They are providing various type of health policies. It may be government, it may be private. And third is the community. Community, these are the populations. So health providers, government provide to the maximum members. Private members out of the community, those are buying specially. What process is there? The insurer, they have to pay some amount of the premium, or government is paying some amount of the premium for the community, and providers, they are providing health services or money if the insurer has paid it. And these are very important aspects. Administrative, so simple, easily available, and fast policies are there, providing the quality services, health services, as well as maybe business services are there or commercial services, and there should not be risk. They should cover the risk management. So different types of health insurance policies are there provided to the employer, also providing for their workers as well as individual. They are taking insurance by the NGOs, especially the underprivileged area are providing the mass community, those are in risk area. And there are certain special members are there. The central government or state government, they are providing the health insurance like central government health services, and for the central workers, national workers, whereas state workers, they are getting ESIS, employment state insurance services. So how should be the health insurance policies? What principle they have to follow? It may be private, it may be government. So first and very important, universal coverage, right to access. Every individual can access. Nobody will keep out. Everybody is in, nobody is out. Those are fulfilling the requirements, they should get it. Second, the same coverage for everyone, or equity we are saying. So same policies, same services to the any member. There will no discrimination of any basis. Third, comprehensive coverage or appropriateness. So they should provide all type of health services, medical problems, surgeries, rehabilitation, or in case of even their reimbursement. Then affordable premium, amount of the premium should be minimum and getting the maximum services, quality services. Low administrative costs. So administrative members, those are providing, business members are there. That cost we should very low or free of cost. Non-profit delivery system. Non-profit delivery system, especially the government agencies with very costs. Later on you will get some examples with 2 rupees, 1 lakh, 2 lakhs. Why? Each and every who should get the health insurance policy or who are in need of health insurance policy. The one word is gave the clear idea, that is everyone. Everyone before birth, as a fetus, after birth, up to the die. So everyone, every individual. There are group family members also we can take health insurance. Certain groups are there, like workers are there, senior citizen, major health problems occurs in senior citizens, so they should get it. Chronic illnesses are there, diabetes, hypertension, cancers are there, then loss of certain body parts, certain defects are there. Students, because they are not earning, they should cover the health services maximum. And socially weaker sections, especially slum areas are there. So everyone is in need of health insurance. Why we need? Uh, because day by day the health problems are increasing. New diseases are coming, or previous diseases, they are showing in a different form. Why? What are the reasons are there increasing of the health problems? First is a poor lifestyles. Poor lifestyle, increase of the bad habits, smoking, alcoholism, overuse of the technology, the mobiles, from one day the child to the death. Everyone is using or abusing the mobile like devices. So other work is hampered, exercise are hampered. Third, toxic foods. We want tasty appearance, good food, fast food. These are not food, but these are nothing but poisons in the form of food, because so many toxins are added. Pollutions are there. Pollution of air, pollution of water, pollution of soil, food, light, sound, everything is there. So whole our environment, inside body, outside body get polluted. Lack of the exercise. So technologies, settle work, and comfort measures are there. Lack of exercise. When body is not working, body will get various health problems. Mental stress and stress. So expectations are very high, efforts are very less, or chances are very less. If it's not getting it, it's very difficult to accept no rejection. It starts from the childhood to the old age. So it leads mental stress. So nervous system get disturbed, whole body organs are affected. Accident, vehicles are there, then environmental degradation. Just I told the different type of pollutions. Deforestation is the one of the example. Nowadays you can see how the environment change. Morning there will be very cool, afternoon there will be very hot, and evening there will be rain. All the seasons you can see at a time. and pollutions causes various diseases. So how to promote health insurance policies? Already the health insurance agencies are there, their representatives are there, they are doing, but they are not able to cover whole population. So what its important actions are there? So as an every educated member of the citizen, they have to teach about the references, where is the health insurance policy available, what are the benefits are there, give the references so they will interact. Second is make the awareness talk. It may be directly like our this session, or you can arrange the awareness talk. Motivation and provide the help. So motivation is half part, and providing the help to get or up to getting the health insurance is very important. Organize talk of the representatives because they are giving better information. They are giving better information. Then use of the various mass medias. It may be internet medias, radio, TV, paper, and others. Then last is very important. There will be pre-question answer sessions by the educated member as well as special representative members, and wherever the health insurance are needed. Hospital is the main area where large groups are there. You can share this information. These are some examples what health insurance different policies are there. That most common in India, we are using the Ayushman Bharat, central government health services, state governments are there. Mediclaim, it is a private one, and for the whole community is community health insurance. This is one Mahatma Jyotirao Phule Jan Arogya Yojana for each and everyone. Okay. So few examples I have taken because there are so many examples are there, depends upon the country. The names may be different, but the services that may on an average same. Like Ayushman Bharat, for every citizen it is there. And what is the benefit? Only you have to pay 30 rupees per year. You will get 5 lakhs amount health services. Pay only 30 rupees and get the coverage of 5 lakh rupees. So this is a way how we are getting the various process of health insurance. You have to approach to the particular agency, get it the policy. Then when you are needing health services, you can contact first the hospital setting. That Arogya Mitra, one person is there, he will help to carry out the further process. So there will be registration of the IPD, OPD service person will be there. Checkup is there of the policies and person, and on the basis of that, diagnosis will confirm, treatment is given. Before going to give the discharge, the person will pay the health insurance, or health insurance agency will pay, patient will get the discharge. If the person is paying, the resettlement is there. So through this is a small process how in hospital what they are doing. This is Aam Aadmi. So for everyone 8 to 10, 55 years, you have to just pay 2 rupees and get the 2 lakh rupees health insurance. Central governments, all the members are there, and state governments. The services, they are somewhat similar. What services they are getting? They are getting medical care for each and every worker. Then it also gives the services, all the medical benefit, IPD, OPD services, investigation, drug treatment, transports. Okay. Then give the rehabilitation process. It may be physical rehabilitation, mental, social, vocabulary, other parts are there. Also, they are giving benefits to their dependents, workers, wife, and children's. Disablements in case of loss of particular organ and losing the works, they are getting the benefits, as well as even for the death, funeral expenses they are providing to the family members of the workers. So health services are there, injury services are there, and even after death also. Okay, these are again few examples are there. Pradhan Mantri Jeevan Arogya Bima Yojana. Just you have to pay 330 rupees per, you will get 2 lakh rupees health insurance, or just to pay 12 rupees per annum. Automatic it will be paid and you will get a 2 lakh rupees health services. Universal Health Insurance Scheme. Universal means each and every member of the nation will get it who are fulfilling the. These are especially for the poorest person or underprivileged persons, or those are not aware about the health insurance and health services. So it covers hospitalization, accident, premiums. It may be paid by the government or certain NGOs they are paying. So government and private certain agencies they also come forward to provide the various health services for particular groups, especially those are able to pay and get the health services. These are the some examples of Indian, where are these are the certain examples of overall the world. So from the private, I have taken one example that is a Mediclaim. Most of the countries they are providing. So who are the beneficiaries? Beneficiaries are there from age 3 to 80 years. And what benefit? Along with the health services, you also get the tax deduction of the tax. And it also covers pre-existing diseases. Pre-existing disease there, so they are included in it. That is not excluded. So just revision of that, we are getting the hospital services, we are getting insurance benefits from the company. So even accidental injury will get the health services. This is a comparison of health insurance general and especially private. Private, they are fast, quick, immediate. It is there. Most of the quality services are there, but it also required comparatively high premium. Okay, this is one of the example I'm providing to you. This is a government health services is there, National Health Authority. This is a health insurance taken by the me, where these are the health insurance of the private are there, Future General Health Insurance. So each and every member you can take separate, or as a family member also you can take the health insurance. So whenever there are any goods or services are provided, there may be certain issues are there, problems are there. So you have to tackle it. So issues in the health insurance are there. So many times some of the health insurance they are rejected due to small technical reasons. So in that cases you have to see all the terms and conditions and keep the information or interaction update. So this will not occur. Then dispute of the knowledge and implication of the pre-existing conditions. So from the insurer sides, they are hiding their health problems, not informing and getting the policy. And after getting the diseases, they will ask for the reimbursement. There may be dispute. Third, there is no analysis of fair practice to justice. So who will solve the court matters? So there is no third party is there to solve the such problems. So see the terms and conditions properly and You have to continue, keep the follow up with the agencies, what services, where services, what is needed, you have to fulfill it. Sometimes there may be some hidden charges are there, find out that, otherwise the total charge of insurance will be increased. Third and very important area is community health insurance. Large population, they are provided by the government, NGOs, or even some private agencies. Especially in India, Reliance is there, Tata is the one of main. They are providing various health insurance policies to the underprivileged members are there. One of that example I have taken from the Gujarat state, that is a Seva Yojana. Seva scheme is there. Seva means same employed women associations. So there may be cottage industries are there. The women, those are performing the work at home level or small groups. They are getting the health insurance. So how much they have to pay? They have to just pay 175 rupees to 375 rupees and they will get health benefits of 75,000. This money also be paid by some agencies, NGOs are there, or by the government. Okay, as a nationwide, this is one of the example is there how different countries they are providing different type of percentage of health insurance. So France, about 75% population is health insured. Greece, 50, 55. Mexico, 47. Portugal, 68. UK, about 80%. US, 44%. And developing countries come under maximum 10 to 20%. So it has to change. For that also UNICEF, then WHO, they are also taking parts. Challenges in health insurance. So health insurance, whatever is there, every time when they are taking the health services, they are claiming to get it. So number of claiming is very high as compared to getting it. Low level consumer having very less awareness, so it is very difficult to make them understand. Limited product developments. So the health insurance terms and conditions very important. Some of the services are excluded, including you have to see. Limited staffs are there, especially the health insurance staff as well as health service providing staffs are there or agents are there. Pricing of the demands, maybe administratives, maybe advisors, they are asking for high payment to get the health insurance. Lack of proper communication. Third party administrators so get very clear meaning of each and every word or try to understand meaning between two lines. Next, delay settlement is there. So the technical problems are there, maybe corrections of certain terms and conditions. It may take some time, but these numbers are completely very less. And different insurance companies they are giving different policies. So the amount may be different as per the facility providing ability of the companies. They are providing different services or maybe some additional services. Lack of standardization accreditations. So this is important. Even the IRDP is controlling it, government body is controlling it, but this control in is lacking of standardization accreditation of the private agencies, especially as well as government agencies. Then insufficient data is there of Indian consumers are there. They are taking the policies, but they are not communicating whenever it is required to the central government or state government. So what are the risks are there? So when you are doing any work, there will be certain risks. Sometimes in emotional state, you can select certain health policies that may be unproper to you. Adverse selection is there. So get clear idea and then you have to select. Sick people enroll in large numbers as a company compared to the healthy members. So mainly it is needed before getting the disease. So preventable health services as well as preventive care. Second, the cream skimming, or it also called as risk selection. So opposite or adverse reaction by both ways, insurance companies or individuals, they are asking for certain different aspects are there. Individuals, they are asking more amount or more services, whereas companies, according to their terms and conditions, they are providing maybe lower than the what they have said. Then moral hazard, that is one risk is there. The fact is being insured changes behavior. So before that, even the disease, it is hidden, and immediately after the policy, they will show the disease and ask for treatment. And lastly, demand and supply, especially it is based on the health providing policy provider agencies and health team, health insurer. So health insurance, they are providing the health services and other benefits, but there are certain exclusion conditions are there to whom it is not getting the health insurance policies. Okay. So few of that is a pre-existing treatment. Nowadays it is also available for that, but there will be limited amount of reimbursement treatments are there. Then STD diseases, it is prohibited. Are there injuries, specially intended injuries, life-threatening injuries by the self or other word is suicide are there. Then the treatment for addiction, treatment for various addiction they are not providing. Dental services are not there. Cosmetic services and costly investigations they are not providing. So some terms and conditions are there. They are providing and not providing. Get it clear. Get it clear. But more common, intentional or suicide way. Then pre-existing diseases are there. Cosmetic and dental care and very high-paying investigations. This is a one question asked by the many members, individuals are there. What is the question? What if I don't get sick? Don't I lose money? It means I have bought the health insurance policy, but whole year I was not sick. It means I have wasted my money which has given to the health insurance policy. If the question comes, you have to give the clarification that way. Just see the benefits of health insurance, benefits of the health services, benefits, cashless payment. There is no, uh, there is no chance or sell your property and other things are there. You will feel secure because whenever you are need, they are providing the health services without cost. Tax benefits are there. Mind freedom is there because no one need to borrow some money or ask for money to any bank or other members. So you have to think in that way. What are the all benefits are there? So you are not losing your money, but you are getting much more money than what you have insured. These are the very important points before ending the discussion. So you have to educate each and every health insurance member, insurer. First point, select proper health insurance policy. So see the terms, take the help of advisors, whatever services are available, where they are available, what is the cost, get it the sufficient time, think on it, and get the health policy. Second, keep the record safe. The record is important because it is a contract. If record is not there, you will not get the benefits. So keep the record safe. Third, pay the premium before time. So even single day you are missing, the company may not be provided its benefits. So better to pay the premium before the time. They are giving at least 1 or 2 months prior period or after also. So in that period you have to pay. Keep some reminders by using certain technologies. Then update time to time. There may be certain changes occur by the central government policy agencies in that policies. So keep it, update yourselves or whatever they are asking, you have to provide the information regarding it. Last, you to take help of the health advisor. So select proper policies, keep proper the record, pay the premium before time, update time to time, and take help of the advisor. So the futures, we can imagine it on the basis of past and present. Same thing, health insurance in future, what may be there. There are few points are there. First, very important, health insurance, it will be on high demand in future because of the awareness and its importance. Second, consumer driven health insurance. Consumer driven means consumers say, I want this. So their needs and choices, the agency has to provide health policies. Third is for telemedicine. We are providing health services. So the health policies, the terms and condition will be related to the telemedicine. Telemedicine, we are providing with the devices like artificial intelligence, computer. The person maybe from one part of the country or other part of the country through internet services, computer services, they will interact with the help of the robot. The health services will be provided. Next, value-based core model. Value-based core model means we are providing high quality care with low cost. How is it possible? Because everyone is insured. So nation is getting sufficient funds. So nation or agency can provide quality care with low cost. Next is the services for even mental health and behavioral health problems. Till now it is not included, but in future it will include because day by the stress and strains are increasing, mental health problems may occur or they are occurring. So health insurance will be available for that. And even for technology related health problems. Just take example of the mobile. Each and every body part get affected. It may be physical part, it may be intelligence part, it may be emotional part, communication part. So technology related health insurance will be there. These are the few research studies are there. Some videos are available according to their country. They are providing in their own language. Use their own language, so you'll get better understanding. In summary, this information was just snapshots. What is the health insurance, where you will get, what are the types are there, what requirements you have to fulfill, what benefits you are getting, what is the process, what is the problems, what are the challenges are there, and what is your role or how you have to take care of it. Actually, it is very big topic is there because so many health insurance policies are there, each and every having a certain importance. I have just shown the road where you can walk and it's far away. So everyone has to take it as it is a need of each and everyone. That's why the title was given health insurance. It's everyone's need. Before birth, during, even up with the death. So before life, during life, and even after life. Conclusion, having the health insurance helps to protect us from the high healthcare costs to the most of the people, which cannot be meet the health services. It also helps to get quality health services at their places. Health insurance, it is nothing but wealth insurance, property of yourself and your wealth. Because just I gave the example, so many members, they are selling each and everything for their health problems. Okay, last but very important, get insured, get secured. Thanks, especially those are the attending by direct as well as YouTube, Facebook, or any other mass medias. Especially, I'm thankful to IGP organization. They are providing me the opportunity and giving me the honor, and they are keeping in touch with me always. And secondly, I am very much thankful to my management, Bharati Vidyapeeth University, Secretary Honorable Dr. Vishwajit Kadam sir, my regional director H.M. Kadam sir, and my principal and dean, Madam Dr. Mrs. Nilima Bhore. Once again, I am thankful to the participants, organizers, and my health agencies. Even I can also say that thanks to the media, the internet, there was starting problem, and also device, they have helped me to interact with you. I feel very uh, uh, happy. So with certain difficulties, we are continuing it. Thank you, ma'am.
Thank you so much, ma'am. Thank you so much, sir, for your fantastic presentation, which can impact our knowledge seekers surely. After your presentation, I hope our knowledge seekers can learn something new, which is our only intention, learn and grow together. IGP knowledge seekers. Once again, thank you so much, sir, for your presentation. Now, sir, it's time for our question answer session, which is the one more variable part of our regular webinars. Honorable sir, hope, please stay with us. After a short video, you'll be back in our session part 2, which is our question answer part. Okay, sir? Dear IGP knowledge seekers, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have open a certification and online quiz competition. Once again, welcome back, everyone. It's time for our question answer session. Participate or request to ask your question in the comment box as well as you want to know from our speaker. Thank you. After question answer, we have webinar certification and online quiz competition. Let's welcome back our speaker. Once
Yes,
again,
ma'am.
welcome back, sir. Dear IGP knowledge seeker, we are waiting for your question. If you have any question, you can ask in our comment box. Our speaker will answer those questions. Dear IGP knowledge seekers, we are still waiting for your question. So please ask your question if you have any question. Sir, I think there is one more question.
We'll continue the quiz competition.
Okay, sir. Once again, thank you so much, sir, for your time in IGP. We have learned a lot from you in your topic. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable sir, hope to see you again with a new topic and the new day. Thank you, sir, and take care.
Thank you, ma'am. Thank you to whole team of IGP. It's nice to interact with you.
Okay, sir, thank you. Sir, before we move to the next process, if you want to leave this studio, you can, sir.
Okay, ma'am.
Dear IGP knowledge seeker, we are sorry today our some technical problem. We cannot share our certificate code. We provide our certificate code in a short time. Dear IGP knowledge seeker, today our some technical problem. We cannot share our certificate code. We provide our certificate code in a short time. Thank you. Dear IGP knowledge seekers, time for the most engaging part of this webinar, which is an online quiz competition, which is our regular webinar activity. Now time for the online quiz competition. To join the online quiz competition, please follow my instruction carefully. First, you have to go www.slido.com and find today's quiz or scan this QR code for direct joining. Quiz code is Global IGP. Quiz code is Global IGP. After short video, we'll be back. So please in the meantime everyone join and mention your friends to join our quiz session. once again, welcome back. It's time for our most engaging part, which is our quiz part. To join our online quiz competition, first you have to go www.slido.com. Then you have to enter the code, and the code is global IGP, and the code is global IGP. It is easy to join the quiz part, so mention your friends to join our quiz competition. We will pick your name from Slido, so join with on your certificate. Top 10 will be awarded with quiz completion certificate, and top 10 will be awarded with quiz completion certificate. So please everyone join our quiz session and mention your friends. Already 30 people joined with us. Within 2 minutes, we are going to start our quiz session. So please everyone join our quiz session early. Now we're going to start our quiz session. So let's start. Our first question is everyone needs health insurance. Is it true or false? Everyone needs health insurance. Is it true or false? And the correct answer is true. 100% people are right. The next question. A citizen has the right to dash own health insurance. Is it them? And second option is his or her. The correct answer is option 2, his or her, and 93% people are right. Now to our next question. And the question is your health insurance copy is option 1 applied on an annual basis, second option a fixed amount of money you pay each time you use your plan, and the correct answer is second option a fixed amount of money you pay each time you use your plan, and 78% people are right. Next question is how can you obtain health insurance? Is it option 1 shopping on the health insurance marketplace? Second option is signing up at your family doctor's office. And the correct answer is option 1 shopping on the health insurance marketplace, and 50% people are right. Our fifth now question is my job has nice dash. I get health insurance and a car allowance. Is it benefits? Our second option is pops. And the correct answer is benefits, and 96% people are right. Move to the next question. The question is form used by most health insurance payers for claims submitted by providers and suppliers. Is it CMC 40,100 for health insurance from claim from, and second option CMC 1500 health insurance claim from? Is it? And the correct answer is option 2, and 30% people are right. And now we are going to see our seventh question, and the question is health insurance, employee daycare, and training are investments in is option 1 coverage limit, second option out of pocket maximum. And the correct answer is coverage limits, and 90% people are right. Right now, question is what insurance provider is the oldest and largest of independent health insurance in the USA? Is it optional Blue Cross and second option Blue Shield or second option Medicare? The correct answer is option 1 and 48% people are right. Next question. And calorie covered in private health insurance can assist with which of the following cost? Is it option 1 general practitioner fee, second option psycho, dental and optometry? The right answer is option 2 and 28% were right. Our last question. Which of the following forms is used to submit health insurance claims for insurance claims for a provider's office? Is it option UB for 4? Second option is CMC 1500. Correct answer is option 2 and 75% people 5% people are right. Congratulations, Sheila Me. She is our top one. In second position, we have Christopher Abenich. In third position, we have Janelier. In fourth position, we have Alex. In fifth position, we have Kiefer Rivera. Congratulations, our top 10 quiz competition winner. We have all of your name which you entered during joining. We'll pick your name from side and prepare certificate and we'll post them on our Facebook official page. Congratulations to our webinar online quiz competition winner top 10. Congratulations again. Slide will take a few minutes for finalizing the result and after that we will show our online quiz competition certificates on our Facebook official page and group. Our Facebook official page and group name is Institute of Global Professional. At the end of the moment of our at the end of the moment uh, of our session, we can say properly feed your skill, never stop learning, because life never stop teaching us. Be happy and stay safe. See you again and again. We want your participation in our every program. If you want to live a happy life, try to people. Try to a goal, not to people or things are but understand. Before I say or hit the end button, again wants to thanks all IGP knowledge seekers for your active participation as always. See you in the next session. Till then, stay happy and blessed. Thank you everyone.